Hello, Mrs. Williams. This video has been made to help you follow up on your recent stroke so that you know what to be aware of and what to report when you come in for your appointments. It is important that you understand the signs and symptoms of a stroke so you know when to get help. These include difficulty in comprehension, various types of vision loss, uncoordinated movement, a headache, dizziness and vomiting, as well as changed awareness.
The acronym FAST is extremely important in order to understand if someone is having a stroke and to know what to do. The first letter stands for face drooping and means that the person who is experiencing the stroke will have one side of their face hang lower than the other and will have a loss of movement. The second is arm weakness, which means that the person will have numbness or paralysis of their limb. Third is speech difficulty, which means that the person who is experiencing the stroke will have slurred speech or will be unable to communicate entirely. And the last letter is T and stands for time to call 911.
If a stroke occurs, get help as soon as possible. This is because the longer it takes to get help, the longer the brain will not get the oxygen and nutrients it needs, which can lead to irreversible brain damage as the tissue dies. This means a person can experience cognitive problems like trouble understanding, speaking, and remembering. It can also lead to sensory and motor problems like trouble feeling and moving around. It'll be much harder to regain these functions even with therapy the longer a person waits. In severe cases, waiting too long can lead to seizures, coma, or even death.
When it comes to strokes, the key to saving one's life and minimizing the most amount of damage possible is acting fast. If signs of a stroke are present, call 911 immediately and do not drive yourself or let someone drive you. Emergency treatment for strokes begins in an ambulance, and you may be diagnosed sooner. According to the Centers for Disease Control and Prevention, 1 in 3 patients never calls 911. Time is crucial. Actions must be taken immediately in order to reduce the amount of brain damage as possible. Every second counts. The primary goal is to minimize brain tissue death and preserve as much tissue as possible. Possible life-threatening consequences may result if one is not quick. For example, treatment must start within 6 hours of the onset of symptoms.
Areas in your brain control your bodily functions, such as growth and decision-making. When you have a stroke, areas in your brain can be damaged. When these areas are damaged, your bodily functions may not work properly. Common symptoms after a stroke are frequent loss of balance, confusion, trouble sleeping, and strong, uncontrollable emotions. If you have these symptoms, you may need to speak to a health professional.
Be sure to report any areas of concern to Dr. Zuma during your follow-up appointments. This includes any changes to your senses, such as new or worsening pain or numbness, double vision or other vision impairments, and problems with short-term memory loss. Depression is common amongst stroke survivors, so let them know about any changes in sleep or eating habits, lethargy, irritability, fatigue, self-loathing, or suicidal thoughts. Working with Dr. Zuma will ensure you make the best recovery you can.
Thank you for watching this presentation. Please remember this information and report any relevant changes or symptoms when you come to your appointments at the Aztec Community Medical Center.